one of the things I thought would be useful to start with is in one of the RCTs that you were a part of, that you had a treatment group and a control group, and the control group you ended up calling transgender affirmative therapy. So that's the control, right? And so it's like your approach was a treatment as usual and then a treatment as usual plus, but you called but treatment as usual, you're like, yeah, this is more than just treatment as usual. So let's call it transgender affirmative therapy because there's more built in here. And I was wondering if maybe it would make sense to sort of start off with you describing a bit about what transgender affirmative therapy, what that means, what that looks like.
When we were first designing the RCT, we talked with community members, trans community members specifically, about the design of the project. And the main piece of feedback that we got initially was, do not include a wait list. Like, that is demoralizing. If you include a wait list, people will feel really upset about
this is feedback from the community members.
Yeah. And so, because initially I think we were thinking, oh, we'll do, this very typical, we want to follow this gold standard way of designing RCTs. And especially when we're thinking about, a treatment that people haven't really looked at before, you would do a wait list, and then you would try this new treatment that you're thinking about. And it was interesting because already the initial feedback that we got was, do not do that. People will not want to participate and they'll feel really demoralized. And so, and especially I think part of the conversation around the ethics of there is, that people who are 2S10B experience a lot of distress. And I know that you might have some questions about minority stress kind of in subsequent parts of this podcast, but kind of thinking about that the experience of oppression does increase the rates of depression, anxiety, but specifically, suicidal ideation and suicide attempts. And so kind of thinking about the pretty high rates of suicidal ideation and suicide attempts and thinking about the ethics around a wait list and what that means when you can have a provision of a mental health treatment. So just to say, we had lots of conversations about the ethics of a wait list and what that would mean and what that would look like. So we thought for sure the control group needs to be some type of treatment and some type of treatment as usual. So we were like, great, we'll just, when we initially were designing this, we were really interested in having a minority stress intervention and an intervention that really addresses oppression and psychotherapy. So that was our goal. And so when we started designing the treatment as usual, we said, great, we'll just have, therapists in the community provide, their therapy that they normally provide. Then there was question around but what if they microaggress the clients? And what if all this information that we have about the things that therapists are doing wrong, is it also ethical to then just send clients into a scenario where that's the case? So we had lots of conversations about this. If we're actually interested in oppression, and that's kind of what we're trying to figure out how to address in a psychotherapy context, if you're sending clients into a situation where they might experience oppression from the therapists, we're not even going to be able, how do we even measure the experience? So then we thought, well, all the therapists have to be trained then in how to not microaggress clients. And that's a very reductive way of talking about trans affirmative therapy. But in the very least form, it's training therapists how to make sure that they have a basic level of competence regarding language to use and basic level of comfort in the topics, and also in kind of understanding and having information about different processes of social transitioning or medical transitioning, things like that. So general trans affirmative therapy is just what I would call more of a basic level of competence and knowledge, information, and skills that therapists have when working with trans clients.